To have a double mastectomy. What is the procedure and why did she have it? Dr. Kristen Woodward is here to talk more about this morning. It really is what everybody's waking up to say, wait a minute, she didn't have breast cancer, yet she chose to have a very serious surgery.
Yes, well, she had a BRCA mutation, and the BRCA gene actually is a cancer suppression gene. So if you have a mutation in the gene, you have a significantly increased risk of developing either breast cancer or ovarian cancer.
Let's talk about what the BRCA gene, or the BRCA, is that what people commonly call it? Do most people know if they have that, if they have a family history, or how do you go about knowing if you have this?
Right, that's the big question here, is how do you know? And so what we look at is maternal family history of breast cancer or ovarian cancer. So either your mother, even a sister, your mom's sisters, or a grandmother, if they've developed breast cancer at a young age, this is something your doctor will probably bring up with you that you should have screened. Now, it's a very expensive test. However, most insurance companies will pay for it if you do have that family history.
So if you have a mom, you have a grandmother, even a sister that has had breast cancer, you can ask your doctor, ask your insurance company if you can have this. It's a blood test, correct?
It's a blood test, a genetic screen. And actually, when you go get a mammogram, they have you answer all these questions.
Yes.
And then they'll actually call you and say, I think this is a good idea for you to have this screening done.
Do you think that we're seeing more women who are choosing to simply have the mastectomy, then have reconstructive surgery and all of that without any signs of cancer like we're seeing here with Angelina Jolie?
Well, when you look at Angelina, she had an 87% chance of developing breast cancer.
Because her mother died
and
when
her mother died
56.
when she was very young. And so I think all of those factors led her to proceed, to having this done. And I think that it's a very personal decision, but that's what's really nice about this test, is it can give you a percentage of your risk, and then you can sit down with your family and your doctors and make what is the right decision for you and your family.
It seems more often, and I have a few friends who have been through this, you find a small lump or something to worry about, which then leads to further testing, and maybe then that you have this gene where women then go on to have this surgery. But less frequently that you see someone like her that is taking complete preventative measures.
Right, and again, I think that this is something that you should talk to your doctor about if you do have that family history, because she was saying that her mother died very young, she has young children, and that's what led her to have this procedure. The procedure itself is usually a 2 or 3 stage procedure. The double mastectomies is done usually by a general surgeon who specializes in breast cancer. Sometimes the plastic surgeon at that time will put in expanders, and then a few months later you'll have the reconstructive surgery.
She said it was about a 3-month process from start to finish.
Exactly.
Yeah, which she finished on April 27th. The best part of all of this, I know as a doctor you would agree, is that it's bringing up the discussion.
I agree. And when I heard this morning, I thought this was excellent, that she's being very forthright about what she went through, what her decision process was. And she's even said this isn't the right decision for everyone. But I think that the more that you can hear and read about and even talk to friends who may have had the same procedure done, that's always very helpful for people when they're trying to make a decision like this.
And certainly giving her peace of mind.
Exactly.
Which is a big part of our health.
A big part, exactly.
Thank you, Dr. Woodward.
You bet.
Good to see you. Still ahead on Daybreak, it is 7:48 now. It's supposed to be a top secret recipe, but one Georgia man claims to have